Let's move now to the classification of disease. There are different ways of classifying disease. You can have a topographic classification, which is based on the bodily region or system that is affected. For example, you have abdominal disease or chest disease. These are based on the region of the body that is affected, the abdomen and the chest. You can have an anatomic classification, which is the classification by organ or tissue. For example, you have heart disease or lung disease. Another type of classification is the physiological classification, which is by function or effect. You have respiratory disease or metabolic disease, such as diabetes, for example. You can also have a pathological classification, which is a classification by the nature of the disease process, like inflammatory disease or neoplastic disease that include things like tumors and cancers. The classification can also be etiologic, which means that it is based on the cause of the disease. For example, if you have the staphylococcal disease, those are the diseases that are caused by the staphylococcus bacteria. And the fungal disease are diseases that are caused by fungus, like toenail fungus, for example. You can also have a juristic classification of disease, which is based on the legal circumstances in which death occurs. Some examples are sudden death or death caused by some working or living conditions. You can also have an epidemiological classification, which is based on the incidence, the distribution, and the control of disorders in a population. And finally, you can also have a statistical classification, which is based on an analysis of the incidence of the disease, meaning the number of new cases that occur during a certain period, or the prevalence rate of the disease, meaning the number of cases in existence at a certain time. Now, if you take any given disease, it can belong to many of these categories. It's not like a clear-cut one disease, one category. You can have one disease in several of these categories.